Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for Wednesday, November the 25th. We're honored to be here on the territory of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. Tomorrow, Thursday, at 3 o'clock, we'll be giving a written briefing with COVID-19 case numbers and other relevant information about the pandemic in British Columbia. And on Friday, from here, from Victoria, we'll be giving an in-person briefing, Dr. Henry and I, at 3 o'clock. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you very much, and good afternoon. For today, for our COVID update, we have 738 new cases of COVID-19 to announce, 4 of which are epidemiologically linked, bringing our total number of cases in British Columbia to 29,086 people. That includes 169 people in the Vancouver Coastal Health Region, 443 people in the Fraser Health Region, 21 people on the Vancouver Island Health Region, 70 people in the Interior Health Region, and 35 people in the Northern Health Region. That leaves us with 7,616 active cases, of whom 294 people are in hospital currently, 61 of whom are in critical care or ICU. Sadly, in the last day, we have an additional 13 people who have died from COVID-19 here in British Columbia, bringing our total number of people who have died to 371. And we always express and feel deeply when we have people, particularly our elders, who pass away from COVID-19, and our condolences go out to the families, the care providers, and our whole community who mourn the loss of 13 more people in British Columbia. We have 10,270 people who are under active public health monitoring and 19,814 who have now fully recovered. I do want to report, however, that we've had some challenges with one of our data systems. So I will be reporting right now a data correction in the daily case numbers that affected particularly the Fraser Health Region. There was a technical error in the transfer of data from a lab to the health authority, which meant there were errors in reporting new cases between the 17th and the 24th of November. So the numbers that I just presented today are the end result, but the daily numbers between the 16th and yesterday have changed. The data has been reviewed in detail over the last 24 hours and is authenticated. And this will be updated on the BC CDC dashboard in the coming 24 to 48 hours. And I bring attention to this because I know some people use those daily case counts and the 7-day rolling averages to help understand the trajectory and what is happening, particularly in each health authority. So I will tell you what the numbers were, and we will be posting these, and you'll be able to update them on the dashboard within the next day or two. So on the 16th of November, and we reported 324 cases from Fraser. Sorry, we reported 461 cases, and the actual number was 324. On the 17th, we reported 484 cases. The actual number was 343. On the 18th, we reported 481 cases. The actual number was 537. On the 19th, we reported 308 cases, and the actual number was 417. On the 20th, we reported 294 cases in Fraser Health. The actual number was 610. On the 21st, we reported 488 cases. The actual number was 634. And I will note for those 2 days, our new total for the province rose from what we reported as 516 to 832. And on the 21st, our reported 713 cases, that was actually 859 on that day. On the 22nd, we reported 469 cases in Fraser Health, and the actual number was 525, bringing our total that day to 682 in the province. On the 23rd, we reported 347 cases, and the actual number was 432, which would have brought our total to 679 cases. And yesterday, the 24th, we reported 678 cases, and the actual number from Fraser Health was 443, bringing the total in the province yesterday to 706 cases. So I know we had a dramatic increase in the daily numbers. That was a result of some of these data coming in at a different time. So we apologize, of course, for the challenges. It's always complex when we have many data systems trying to feed into a single report on a daily basis. But as I say, these numbers will be available, and we will make sure that the BC CDC dashboard is updated appropriately. In terms of outbreaks, we have no new healthcare outbreaks today, and the one outbreak at the Royal Columbian Hospital has been declared over. That leaves us with 57 active outbreaks in the healthcare system, 52 in long-term care or assisted living, and 5 in acute care, with 1,036 cases active, including 634 residents and 385 staff. As well, there's been an outbreak. The outbreak at MSJ Distribution has been declared over. This virus, as we all know, is putting a strain on all of us, which is why now more than ever we need to think about compassion and care for ourselves, for our families, and for others. Today, the BC Coroner's Service released their monthly report on illicit drug overdose deaths. And once again, that number has become unacceptably high, with 162 people in British Columbia dying in the month of October. As we have seen, COVID-19 continues to dramatically amplify those consequences that we know are a part of the overdose crises that we have been experiencing here in British Columbia. Particularly, we know the effects of the extreme toxicity of the drug supply, and that is reflected in the high levels of concentrated fentanyl and other analogs that have been found in those people who've died in this past month. I appeal to anybody who uses drugs to ensure you use with your own personal safety at heart. Don't use alone. Let somebody know. Talk to somebody. Use the app. Have your drugs checked. Reach out. As you know, in September, I expanded the healthcare professionals who are able to provide you with a safe supply of pharmaceutical alternatives to what we know are deadly drugs on the street right now. It is also a place that you can go for help. If you are looking for help, reach out. If you know somebody who's using drugs, now more than ever, as we're moving into this critical phase of our second wave, we need to care for each other. We need to reach out. Reach out to your family, your healthcare provider, or you can call, go to stopoverdosebc.ca. There are resources there to help. Today also marks the first of 16 days to end gender-based violence. And with the necessary restrictions in place, getting support and getting away from a violent situation right now during this pandemic, we know is an additional challenge. If you or someone you know is experiencing violence, there is help as well. Contact Victim Link, a toll-free, confidential, multilingual service 24/7. You can call or text 1-800 563-0808 or email victimlinkbc@bc211.ca. This is a time where we need to reach out, we need to connect, and we need to support each other. Yesterday, the Minister of Public Safety and the Solicitor General issued a new order with enforcement measures for the use of masks in all indoor public spaces. This public safety order focuses on those locations where it's not always possible to maintain that safe distance and where wearing a mask is important for your protection and the protection of the people in that environment. It is one of those layers that has become incredibly important as we're seeing this surge in our community here in BC. And a comprehensive list of the locations where the order applies, as well as people who are exempt, is available on our website, and there's a link to it. But I'd like to remind everyone that, as I have said many times, masks are required in many locations, and they are one of the important measures that we take. But not everyone is able to wear a mask, and we need to have patience and compassion for people. Nor does this apply to children under the age of 12. So we do not recommend masks at all for children under the age of 2, or for anybody who can't remove a mask on their own. We encourage it in children between the ages of 2 and 12, but it is not mandatory. And we know that people can't wear masks for many reasons that may not be apparent to you, whether it's a psychological, behavioral, or health condition, or due to physical, cognitive, or mental impairment. So if you see somebody without a mask, have compassion. Understand that while we are all in the same storm, we don't always know each other's story. And people who are unable to wear masks must be accommodated. That means we cannot deny them services, but we need to find alternative ways of safely providing the services that people need. And that may mean providing curbside, online services, or arranging for people who cannot wear masks to come at a time when appropriate distances can be maintained, or when barriers can be in place. And for those of you who are in that position of not being able to wear a mask, you need to as well be aware that this is an important measure right now in our community, and look to alternatives to receive those services you need, whether that's going at off-peak hours, calling ahead, going online, or making arrangements to come at a time when others will not be in that space. These are the things that we all need to do to get through this part together. On the other hand, this order does provide provisions for those people who are deliberately being belligerent about wearing a mask and are putting other people's safety at risk. And it gives the power for police and bylaw officers to take action if that happens. I also wanted to talk for a minute about rapid testing, as that's come up a number of times in questions that I've received. So people are aware, we have received a number of rapid tests from the federal government, including the Abbott ID Now, and that's one that's a machine where it has a certain type of swab that you can put into the machine. We have received 131 of the machines and 27,000 tests. However, as you can tell, that would not be enough, for example, to do all of our healthcare workers in long-term care even once at this point. And we are working on how we can best deploy those machines to help us understand when outbreaks are happening, when people need to be tested rapidly in a community. In addition, these tests are, we've also received about 500,000 of the Bio Antigen Tests. Again, that's the little ticket test that where it has a colored line. Again, these tests, all of these, are still require a nasal pharyngeal swab. So that means a healthcare worker has to do the swab, and if those have had one of these recently, you understand that that's not a simple thing necessarily, because it has to tickle the back of your throat for several seconds. So right now, we're limited in how we can use these. They are also only licensed for use in people who are symptomatic. So people who have symptoms, and we know that even in that case, they're not as sensitive, they're not as able to pick up the virus as the regular NAT tests that we do on an ongoing basis that go to the lab. They are rapid, though. So if somebody does have symptoms, this is something, these tests are things that we can use to rapidly assess whether it's COVID causing those symptoms or not, particularly in some of the more remote communities in the province where if somebody is symptomatic or 2 or 3 people are symptomatic and we need to rapidly determine whether it's COVID or influenza or something else, that's where these tests right now are best suited to support what we need to do. They can also they can also help in long-term care when we have symptomatic people, and that's one of the things that we are deploying already. And we've been looking at, we've been testing them out in places like the downtown east side where we've had cases of people being ill, and it's a challenge to find people 1 or 2 days later when a test results come back. The difficulty we've run into in using it in those situations is they don't actually perform very well in the cold. And we don't have that much cold here in BC, but when they're used in the mobile testing labs outside, they've not been proven to be reliable. So we're still working out what the best way is to use these tests. And we hope, well, we have some expectations, particularly around detection of outbreaks in clusters in communities and in long-term care, and we'll be continuing to move forward with that. I will also say that these are not the tests, so these rapid tests are not what is being used in the NHL or in the movie industry. They are using the same tests that we are, which is the nasopharyngeal swab. So we do have some hopes for these tests in the future. The companies that producing them are hoping to have certified an anterior nasal swab, so that is one that we could self-administer, which would make it much more useful. Those are not yet licensed for use in Canada, although they are in other countries, so we're hopeful those will come soon, and that will make them much more useful for us in certain situations. So I just wanted to bring people up to date on where we are with those types of rapid tests. We are expecting more of the tests to arrive, both the machines and the test kits, in the coming months, and we will be looking at how to best deploy them across the province to rapidly detect outbreaks. And we are hopeful that more tests that get approved will be more useful for asymptomatic testing, at least on a periodic basis of healthcare workers and others. Finally, as we know, there's a light in our future on the horizon as we hear more and more positive news about vaccines. As we know, though, this will be a large, complex undertaking. And to be sure that we have all of the logistics and operational support that we need in place and everything that we need to have, we have been working very hard already. The BC CDC, our logistics teams have been pulling together, working with the federal government to understand the requirements, to safely get the right vaccine and to the right people as quickly as possible in the most efficient way, starting in early 2021. And to help us with that, given the complexity and the scope of the program, today we have appointed Dr. Ross Brown, who's a VP of COVID response for Vancouver Coastal Health, to be the leader, along with myself and the Deputy Minister, of our COVID-19 vaccine program here in British Columbia, to coordinate all that good work that has gone on so far and make sure that we are ready and able to deliver vaccines as soon as they're available to us, hopefully as early as January. So COVID-19 has meant that we have all had to work a bit harder to connect in a safe way with each other. And once again, we are facing that time where it is important for all of us to stay within our one bubble. We used to have the ability to have that team bubble and our social bubble and maybe a work or school bubble too. Now we need to focus on our work, on school, and our home bubble only. This is important for getting us through this next few weeks. We are stronger when we work together, And it's important that we make sure our family, friends, and neighbors know they are not alone. So reach out. Do those things that we did back in April and May to support each other. Talk to each other. Find ways to connect with your neighbors, your friends, your family. We can slow the spread of this virus by making a difference, each of the little things each of us does today. And we know we do that by being kind to each other, staying calm despite our fears and anxiety and the uncertainty of what is happening around us, and by being safe. Thank you.
Thank you very much, Dr. Henry, and I too wanted to start by recognizing and sending my condolences, those of the government, those of the Premier, to the 13 people who passed away from COVID-19 in British Columbia in the last day, 11 in the Fraser Health Authority, 2 in the Vancouver Coastal Health Authority. That's 371 people who've lost their lives as a result of COVID-19 during this pandemic, and I think it's fair to say what we have been saying, which is, and it's true of everyone who's passed away in these times, that this is a difficult time to grieve and a difficult time sometimes to understand the nature of this pandemic, the nature of this virus, and its impact, especially on the most vulnerable people in our society. And so our hearts really go out to the families, to the friends, to the caregivers of all those who have passed away. Equally, the public health emergency that is the overdose crisis in BC. The coroner, of course, reported today 162 people lost their lives due to illicit drugs in the month of October, which is, I think, we'd all agree, 162 too many. And so the efforts to ensure that people have access to safer prescribed alternatives continues apace, and we've seen the extraordinary efforts that have happened since March, that those efforts continue, especially after the decisions made by both by Dr. Henry and the Minister of Mental Health and Addiction, Judy Darcy, in the month of September. And those efforts continue, but in the meantime, we are asking people to not use alone, to take the steps they need to take to the maximum possible degree to have their drugs checked to be safe in these times, because obviously, and this is in part due and significantly due to as a consequence of the COVID-19 pandemic, this is a time of extreme toxicity in the drug supply, and a time where we all have to be careful and we all have to continue to take action. Wanted to note today as well, obviously 700,816 active cases of COVID-19 in BC today. 10,270 people under public health surveillance who are self-isolating as a result of close contact with people with COVID-19, 294 people in hospital. And so, again, our teams across BC are doing extraordinary work, and there's going to be a lot of numbers, or already have been, from Dr. Henry, and I'm going to provide a few more here to put that in context. I'd also like to note that the numbers provided over the last 7 days by Dr. Henry will be included. Those numbers on paper will be included in our update today, in our written report today. After, for those of you who didn't have a chance to write them all down, we'll ensure that they're added into that report, and obviously the BC CDC dashboard will be updated. I wanted to note that yesterday that about 4,989 people were attended at emergency rooms in BC. So to put that in context, the number was 6,559 on March 9th, a representative number from the pre-COVID-19 era, just to give you a sense of the use of emergency rooms these days. And all I can say, I can continue to say, is that our emergency rooms in BC are there to serve you if you need an emergency room, and encourage people to go. Our hospital capacity today is 72.3% of our base and surge capacity in terms of beds, and in critical care, 56% of our base and surge capacity. Of course, our ability to serve people in the system is always dependent on the extent to which COVID-19 both affects our hospital and affects our healthcare workers. And so that's why it's so important that we all act together to flatten the curve. Wanted to also acknowledge Dr. Ross Brown. If people are interested, under Vancouver Coastal Health, there's a very nice biography of Dr. Brown, who's really an extraordinary figure. And we'll make the occasion available to members of the media in the coming days, perhaps to speak to Dr. Brown, so he's not deluged with requests today. I'd also like Dr. Henry wish to acknowledge the 16 days to end gender-based violence and note a report which includes that subject and many others about unmasking gender inequity that was produced by the BC Women's Health Foundation and Pacific Blue Cross, and encourage people who are interested, which I think is all of us, to have a look at that report and at that document. I wanted to update you on a summary of our progress in hiring people to support contact tracing in the province, contact tracers. That this week alone, we've added 222 new hires, most of those in the Fraser Health Authority. So the number of hires is up to 935 since the Premier announced the original plan to hire 500 in August, and that was updated, as you know, in the middle of September to 608. So the people involved in that have done a truly extraordinary job. In addition to that, Statistics Canada, and we're very appreciative of this, the federal government is providing, or will be providing in the coming days, contact tracing resources to the Fraser Health Authority. That's 70 FTEs that will start work shortly to support their contact tracing team. That is not included in the hiring numbers, so that takes us over 1,000 on top of those who are doing contact tracing prior to September. In addition, the Fraser First Nations Health Authority has been approved to hire 76 community health representative positions to support culturally safe contact tracing across the province. And finally, there are 399 more candidates in the interview stage and 109 candidates in the offer process. And that our plan, which was originally to hire 500 contact tracers, is now been dramatically expanded. We have hired, as we said, 935 plus these other positions that I've referred to, and it's our intention to hire over 1,200, and as I say, another 109 in the offer process and 399 in the interview stage. We've had extraordinary response, as you can imagine, and given those numbers from people who want to do this work, and I think that tells you a little bit about how people who are involved in healthcare are committed to helping people in this time of pandemic. I want to also report on the number of surgeries that have been completed in the last number of days, in the last week, as I do regularly at this time in the week. You'll note that last week I reported that 5,520 surgeries have been completed from November 9th to 15th, the week including Remembrance Day. We've, as we do, verified the data, and the total number of surgeries completed was actually 5,793. So that's more than we announced in our preliminary numbers. This past week, we were reporting we completed 6,691 surgeries, which is a number that we expect to rise when the final numbers are accounted for. I might note that this has been affected at least somewhat by the challenges at Burnaby Hospital, including a fire and an outbreak of COVID-19, and at Lions Gate Hospital. Nonetheless, these are extraordinary achievements by surgeons, by health sciences professionals, by nurses, by healthcare workers, and we are appreciative of all that extraordinary effort and commitment. I think I just say finally that obviously this is our effort together, and this is a massive effort. When we talk about the role of Dr. Brown, the most significant immunization program certainly in the history of BC, obviously because of the attention that will be placed on it, but its importance and its speed and the fact that we're dealing with new vaccines, all of that adds to its complications, and we are sparing no effort to ensure that that goes well. And Dr. Brown, I know, will do an outstanding job working with Dr. Henry, working with Steve Brown, my deputy minister. In addition to that, all this work in surgeries and the contact tracing and the supports in primary care and the fact that we're doing record numbers of immunizations against influenza and on and on and on. We are all in, and we need everyone to be all in. We need to look, each of us, at ourselves, and we need to look deep. We must force COVID-19 to loosen its grip, and that is a critical aspect to what we're doing. On Monday, Dr. Henry talked to us about the intent of the order she put in place to help keep us healthy, to slow the spread, to save our lives. She urged us to look for ways to make the orders work and reduce transmission, not to skirt them and spread the virus. We know what she asks us to do. We've been here before. It's familiar terrain. She asks us to bend the curve, not the rules. If we have any uncertainty about our plans, and if they're allowed, if you have a question, if we're unsure if our actions or behavior fit within Dr. Henry's guidance and orders, we need to think about where we are in the BC pandemic, and we need to make this our touchstone. When in doubt, rule it out. Don't invite, don't go, don't join, don't regret, and especially don't regret for the first three. For the next few days, especially till December 7th, when in doubt, rule it out. Our path is clear. We know what to do. We know how to do it. And right now, we need to draw upon our strength and our resolve to stop the spread. Aujourd'hui, nous annonçons 738 nouveaux cas qui ont testé positifs pour COVID-19, pour un total de 29,86 cas en Colombie-Britannique. Nous sommes attristés d'annoncer 13 nouveaux décès liés au COVID-19, pour un total de 371 décès en Colombie-Britannique. Et nous offrons nos condoléances à tous ceux qui ont perdu leurs proches durant cette pandémie. Parmi l'ensemble des cas confirmés de COVID-19 en Colombie-Britannique, 294 personnes sont actuellement hospitalisées, dont 61 en soins intensifs. Thank you very much. Merci beaucoup. We're happy to take your questions.
Thank you, Minister. As a reminder to everybody on the phone, please press *1 to enter the queue. You are limited to one question and one follow-up. I would also ask that you please take your phones off mute. You will not be audible until your name is called. First question today is from Justine Hunter, Globe and Mail.
I thank you. In the most recent COVID situation report that was posted on the BC Centre for Disease Control, there's a graph showing an increasing number of cases where the source of exposure is unknown. I heard you mention Ottawa's lending some contact tracers to Fraser Health, but what more needs to be done to be sure that contact tracers can catch up? Because it looks like they're losing right now.
Yeah, I wouldn't say we're losing, but we're on the edge for sure. So we have reorganized. Last week we talked about how we have developed a coordinated workplace team and schools team and healthcare team to support all of the Lower Mainland. So that has helped quite a lot. Obviously, contact tracing is something where we need to spend time with people. We've automated some things, including the automated response. So people are now getting their test results, whether positive or negative, by text with information about what to do and how to start the process of determining who they had contact with, so that when they are contacted, that can speed it up. And there's an online form that we're putting in play for that as well. So there's a whole lot of things that we're doing to keep the edge on. We are still running around 20 to 25%, and that has been pretty consistent. Most of the cases still, particularly outside of Fraser, and Fraser's been the most challenging area because we've had such a rapid increase in a short period of time, but most of the cases are definitely linked, and ones that we find, we may not find them in time before they've passed on to the next generation, and that's where we're trying to catch up. But we are still very much committed to our contact tracing approach, and it is still within our grasp, though, as I've mentioned last week in particular, it was getting very, very close.
Do you have a follow-up, Justine?
Yes, I do. Thanks. Dr. Henry, you've emphasized personal responsibility here today, but I'm wondering if public health has been given all the resources that you've been asking for. Are you of the opinion that the government has done enough to prepare for this second wave?
Yeah, well, I think we're all wondering that. None of us knew what the second wave would look like. We committed very early on here in BC to make sure, and we don't make these decisions in a vacuum, and it was in looking at what had happened, around the world, that we made our plans for our healthcare surge, and that is holding true. We also committed to hiring 500 contact tracing support for public health in the summer and started that process, and it became clear that we needed more than that, so we've more than doubled that. It's always a challenge to get things in place in time. We have always been challenged with having a common IT system and our lab system. So as much as we ramped up as fast as we could, we had setbacks in that were not foreseeable, some of them. Things like a global shortage of the reagents for some of the laboratory equipment that we use made it challenging. There's so many things. So I don't think we're at the point where we can say we should have done one thing or another thing. We've tried a whole bunch of things. I will say that I was surprised at how soon in the fall we started to see the surge. And we were doing, as you can look at our numbers, we had gone up to 100 cases a day. We sort of gradually went up in September, but we were finding people. And then we had an explosive growth in the Lower Mainland. And now we're seeing that spreading around other parts of the province. So the orders I brought in last Thursday were trying to get ahead in all the other parts of our province, not behind like we were a bit in Fraser Health. So it's timing. We could not necessarily have predicted that, but we've seen the same things happen now in other places around the world. And we committed very early on to testing, tracing, isolation, and we're still barely managing to hold on to that. We've not abandoned that as some of our colleagues have had to do in other places in the country.
And I just say that, the Premier, with the guidance and the recommendations of Dr. Henry and Steve Brown and myself, announced our plan for the fall. It was $1.6 billion is our incremental on top of the existing Health Ministry budget of $21 billion. The extraordinary investment this year, for example, in making up the ground on surgeries, we're adding 16% to our operating room capacity within the year, and that'll be more than 25% next year. And I think, but I think what's true is that we're learning all the time. When we presented here in March about acute care and acute care capacity, we based it on what we understood and what we saw in front of us, which was Italy and which was Korea and which was was Wuhan and was other places. And now we know more about it. We're able to base it on our own evidence. So we put forward a detailed plan to prepare for acute care, to add contact tracing, to add seniors care capacity, to ensure that we could increase our capacity for testing over 20,000, a goal that we have reached. So a lot of those goals we've reached, but this is everywhere in the world an extraordinarily difficult challenge. But if there's more resources that need to be invested to support our strategy, we're going to find them, because this is that important. It's that important, and ultimately that important to our health, to our well-being, to our economy, everything else that we address this public health emergency well. And that's why the Premier announced really in advance of others that we're going to add contact tracers, 500 of them. Two things happened that were extraordinary. One, we saw a continuing need, so we've now more than doubled that. It'll be 1,200 by the end, which is significant. But the other thing that's extraordinary, I think, is the number of people who stepped up and wanted to do this work, who've come back or come back to healthcare, who are retired, who wanted to assist us in this work, and that's made it possible. So we're committed to those strategies and committed to providing all the resources required to achieve what we need to achieve. But all of that aside, COVID-19, everywhere in the world, the second wave is incredibly tough. And regardless of the question of resources, and on top of it, we need everyone to be all in. And I think we've seen in the last week, we've seen in terms of activity in the province, the decline in ferry traffic, for example, and other things, how committed people are. There's a lot of talk about when people step up or don't follow, or don't ask or don't step up and commit to this effort to bend the curve. But the reality is overwhelmingly people are doing that. You see it in grocery stores, you see it in communities, you see it in activity all over the province, and I, for one, am grateful for that. But we absolutely need to keep going and keep expanding that effort.
Next question is from Binder Sajan, CTV.
Hi, Dr. Henry. I'm just wondering, a lot of people rely on these numbers on a daily basis, have quite an interest in them. And I'm just wondering how it is that the data was so wrong for Fraser Health for so many days.
Well, this is the travails of our IT systems and the fact that we've increased capacity in our lab by bringing in other labs that have interoperable, supposedly, systems. So a patch was put on one of the systems over the weekend, and the anomaly was only detected yesterday. So it is one of those things. I obviously would not want it to happen. We know that the people who were tested and tested positive were notified, but there was a gap in when those reports came in to the IT system at the Health Authority. So it is something that happens. Obviously we don't want to, and that's why we're talking about it today, because people do put a lot of stock in the numbers on a day-to-day basis, as do we. And we also look at things, though, and it is a caution in a sense, in that the numbers in any one day reflect a lot of things. They can reflect an outbreak. If we look at the north, for example, there's one large outbreak that accounts for about a third of the active cases right now. So, that is active case finding once somebody's been identified in a common area. We see that with long-term care, with the hospital outbreaks, where a whole bunch of people are tested. There's another large industrial plant outbreak in Vancouver, where we've had dozens of cases who've tested positive on a day. So, the daily numbers tell us a little bit. They tell us how we're doing overall, but what we also look at are the 7-day rolling average, we call it, and that's posted it has been on our dashboard, but it's not as prominent, so we'll put that up as well, so you can understand a little bit about trends over time, rather than, what does a number today mean. What this does tell us, though, is, if we look back on it, our peak numbers in the 800s were actually last week. And yesterday's number was slightly smaller. Doesn't change the fact, though, that we are in a very critical time right now, and we are seeing far too many people being infected with this virus, and that's now being reflected in our hospitalization and people in ICU.
Do you have a follow-up, Binder?
Yeah, just so on that, just wondering how that sort of figures into when you're looking at why the cases in Fraser Health continue to soar. I know we saw spikes after Thanksgiving and Halloween. Just wondering, is Diwali a factor here? And are you considering declaring Surrey a hot zone, as others have done in other parts of the country, and perhaps bringing in different restrictions there?
Yeah, so the second question, no. We look at a whole bunch of things. So some of the data that is not reported on an ongoing basis is what Justine Hunter asked about. What are the outbreaks? What are the linked cases? So we are not seeing cases related. We've seen a decrease in cases related to and outbreaks related to parties and weddings and Diwali. We've not seen a surge in people at those types of celebrations, so that is a positive thing. What we are seeing is that surges, and we're picking up and detecting clusters in outbreaks in other settings now. So that's come down. We're now seeing that second phase, and if you remember the graphics where we had a person who went to a spin class and then it spread to a bunch of other people and they went to workplaces. So we're now at that, there's clusters in workplaces that we're detecting. So we do look on that at that in public health on an ongoing basis. So we have a pretty good idea where transmission events are happening. That's why we've put in some of the restrictions we did on indoor group fitness activities, for example. We put restrictions on, and we closed down eventually, nightclubs and certain bars and banquet halls, because those were the settings where we were seeing lots of transmission happening. Then we saw lots of private parties and people not following the gathering rules at weddings and birthdays and other things, or parties in people's homes. So we do look at that in some detail, and even today we had some discussion about where we were seeing and what other measures might be needed in different parts of the province related to where we're seeing transmission events happening. So it is very detailed behind the scenes that is sometimes not able to be reflected as well in just the numbers.
Richard Zisman, Global News.
Thank you so much for taking my question. I'd like to ask you, Dr. Bonnie Henry, about what's happened at Burnaby Hospital. I know there was a report on this from Fraser Health yesterday. There are some concerns around where patients were kept during the challenges there. There were some that were moved into city buses to be treated, while others were in other temporary rooms. Are these type of emergency protocols being reevaluated? And with Burnaby Hospital no longer accepting patients, is it putting a strain on other hospitals in the area?
Yeah, so I can talk to it a little bit, and this is an unfortunate event that happened at a very inopportune time. So we knew there were people with there was a cluster of COVID cases in workers and patients. Started small in one of the medicine units, and then with the fire, yes, people were moved around, and they had to be very quickly. And it is likely that contributed to some of the transmission probabilities and transmission events between people, between patients, between healthcare workers. And what can we do about that? It's very challenging in an emergency situation like a fire, like the fire that they had, to safely get people where they needed to be. So it is very likely in retrospect that contributed to spread of the virus to other areas of the province, of the hospital. Having said that, the emergency department is still functioning. Admissions are going elsewhere, and the NICU, the ICU, and maternity and palliative wards have not been affected, and so they are still functioning normally. Where the strain really is on healthcare workers. I mean, if you can imagine working in that hospital, dealing with the outbreak that was going on, dealing with the influx of patients that we're seeing in the emergency department with respiratory illness, and then having that fire on top of that, it has been very stressful. And there are also quite a number of healthcare workers, I think they're up to in their 40s, who are either positive with COVID or need to be in isolation. So that is also a strain. That is why all of us, that reflects, some of that may reflect community transmission to healthcare workers as well. So we need to work together to take that strain off on Burnaby Hospital, on Surrey Memorial, on St. Paul's, on all of our healthcare systems are starting to feel stretched right now. Having said that, in terms of people getting care, the emergency departments are safe. They are still able to function, and we have a backup plan and a surge plan across the Lower Mainland and across the province to support what we need to do for hospitals, for people who need admission or surgeries.
Richard, do you have a follow-up?
You mentioned in your introduction around businesses changing their service to help cater to those who cannot wear masks. Are you concerned about the treatment of people who are not able to wear masks? And are you concerned at all by, some of these cases we've seen of people, anti-maskers, people who don't want to wear a mask, going into stores and saying they are not going to put on a mask?
Yeah, so the second part, people who are belligerent about this and are doing it to make a personal point, and those are the people that this order are designed to help support, both people who work in those retail shops to keep them safe, or those places where people are doing that, and to enable police to take action as needed, and people to know there are consequences from taking unsafe actions like that. My concern, obviously, is that people who truly cannot wear a mask for a variety of reasons are going to be treated poorly because of people like that who are making a misguided point, to be nice about it. And I am particularly concerned about people with disabilities that may not always be readily apparent. And I know that they feel very vulnerable. I've heard from many people that I'm in touch with, that I know, who have concerns that they aren't able to put on or take off a mask, or they have challenges in wearing one, in being safe with one on. So we do need to find that balance. I have no time for people who are belligerent and are trying to make some sort of a statement about anti-vax and think that this is not a truly challenging pandemic. And I have no time for people who believe that wearing a mask somehow makes them ill or is a sign of lack of freedom. To me, it's about respect for our fellow people who are suffering through this with us, and about making sure we're doing our piece in solidarity to get us through this really challenging time. And I also want to make sure that we are protecting the ability of people who truly cannot wear a mask to get the services they need. So I'm calling on all of us to be mindful, to be compassionate, and to make sure that we're treating each other with respect.
I think it's important to emphasize all of that. You know, last night I had the chance at the end of the day to phone some healthcare workers who work at Burnaby General Hospital, and they told me what they were going through there, because it's stressful. I mean, all of the services, and Dr. Henry's describing the services that are open, the hospital is still serving its patients, but it's extraordinarily stressful. And all four of those people expressed that stress, and they were going into work today, and they went into work today. And for them, and for a couple of families I talked to yesterday who have loved ones in long-term care who are in the midst of an outbreak. Those things, and they can't visit their family members even under the visitation rules we have now because there's an outbreak. Well, that's unjust. It's unjust that all of people have to go through this, but we do together. The virus isn't arguing with us. And so when people use terms of injustice, they should be properly applied. We announced today 13 people have passed away from COVID-19. That is serious business. It is awful to have to do that. It's awful for the families. It's awful for the caregivers. This is a pandemic that's affecting the entire world and is affecting all of us a great deal. So when people try and compare what really is at best inconvenience with injustice, I think they're just wrong. And I asked everyone to do what I see happening all over, which is a lot of compassion for one another, with some exceptions to that. And right now, wearing a mask is in indoor public places is a sign of respect for one another. It's the law, it's the rule, but it's also a sign of respect. And I think there surely is somebody out there, a mom or a child or someone you don't know, or a friend or someone you know who works in healthcare, who one should be doing that for. And I really encourage people to do that, and to take all the other steps that we need to take: the physical distancing, the washing hands, the core public health things that we need to do right now, the not going into work sick, in order to help one another, because this is a difficult time and we can get through it. And I've seen nothing really significantly as I go out in the world, and with a couple of exceptions to this, but an extraordinary effort by people to try and engage and to both follow the rules and do more than that. And the good part of that makes me proud to be a British Columbian, and others, I think, need to reflect when they claim injustice here about wearing a mask, what really is injustice, because there are people genuinely suffering and working hard in extraordinary circumstances, and we need to be with them.
Next question is from Simran Singh, Daily Hive.
Hi, Dr. Henry. Thank you so much for taking my question. I have a question regarding the strategies in the Fraser Health region when it comes to helping people isolate. I know that in the Peel region in Ontario, there's finally being that isolation center set up, and the Peel region seems to have similar qualities as we see in the Fraser Health region when it comes to multi-generational homes and essential workers. I wonder if this type of strategy would also be helpful in the Fraser Health region, or if there's any plans to do that.
I'm really sorry. You were breaking up through part of that. I think you said something about a strategy that's being used in Peel region for multi-generational homes, but I wasn't able to get much of.
Can you hear me? Sorry, I have horrible reception. I was just speaking about a strategy being used in Peel region in Ontario, where there are an isolation center being set up, and if there's a plan for that in the Fraser Health region, as we have multi-generational homes and essential workers, and that could be seen as helpful in that region.
Yeah, so I recognize that Toronto has also done that, and we actually did that quite some time ago, both in Vancouver and in Fraser. There's that ability to provide services, and we've used it particularly for people who are living in shelter or who had challenges with homelessness or crowded housing. So we have used some of that. It's not been a huge issue in the Fraser Health. Despite some of the multi-generational homes, but that is one of the things that is offered to support people in terms of being able to self-isolate in those homes or away from the home. The other place that we found it quite helpful is many of our First Nations, part of their emergency response plans are having places where people can leave the home, either somebody who needs to isolate or in some cases removing those who may be more vulnerable to temporary places where they can still stay in their community but can be safe from somebody who's infected with COVID-19. So those are strategies that we have been using all along.
Simran, do you have a follow-up?
No, I don't. Thank you.
Thank you. Next question is from Vaughn Palmer, Vancouver Sun.
Good afternoon, Dr. Henry. Report out of Ontario that they already are using rapid testing, the ID Now 1 and the Bio Rapid Antigen Tests. They're using them in 10 hospitals and 30 long-term care facilities. Is that a sign that perhaps they got more of the supplies than we did here in British Columbia, or that they may have figured out how to deal with some of the concerns that have been identified here?
Well, it's a bit of both. They have been distributed by population, so we get fewer than Ontario because they have a much larger population. And all of us are looking at the validation in the places we want to use them. But our plan is to use them in very similar ways to what Ontario is doing in terms of detecting and helping rapidly identify cases in remote communities and in long-term care, and in some cases in hospital outbreaks. So it is for symptomatic people, so they're not doing testing of asymptomatic healthcare workers using those tests on an ongoing basis. It's to help manage outbreaks. But I'm still hopeful that particularly if we get some tests that are more sensitive and work better in people who are pre-symptomatic, so it's that period of time before showing symptoms where people can spread the virus, or asymptomatic, and we can get a nasal spray, a nasal swab instead of a nasal pharyngeal swab, then it's amenable to self-selection, self-testing, that we'll be able to use them. One of the challenges that we've had across the country, and I talked with my colleagues in Ontario about this, and our lab has been talking with their lab too, is trying to understand how to best use them and to validate them again against what we have and the NAT tests we're using. So they've just started that, and we're looking at it too. I was hopeful that we would start before now, but it takes time. one of the biggest disappointments in this pandemic, and I'm just thinking back to Justine Hunter's comment about, what could we have done more, is we have had real challenges and globally in getting accurate tests. Our NAT tests, the ones that we have that we're doing in the lab, are excellent and they work really well. But the rapid tests and the serology tests have not been as useful as we had hoped way back when. I remember saying, once we get the serology tests, we'll be able to find out. But the serology tests took an awful lot longer. They're still not as accurate as we need, and you have to do 2 tests. And there's been hundreds of rapid tests developed, but most of them aren't valid enough to help us on a day-to-day basis yet.
Do you have a follow-up, Vaughn?
Yes, please. I wanted to ask about the review that will be overseen by Dr. Brown. A while back, you referred us to the guidelines or the recommendations of the National Committee on Immunization, what it suggested should be the priorities, given that there will be a shortage of vaccines initially. Is that still the general framework we should be looking at to see how it will be done here in British Columbia? And are there different things about BC that would perhaps mean different guidelines or changing some of the guidelines?
Yeah, so Dr. Brown's not going to be doing a review. He's going to be working with me to make sure that we have all the operations and logistics in place. So when vaccine comes, we can get it into the arms to protect people as soon as we possibly can and most efficiently as we can. But yes, part of that will be communications, part of that will be looking at our IT systems, looking at how do we physically get vaccine that needs to be frozen to -70 to the places we need it to be, who's going to deliver it. So he and I are going to be overseeing that whole program, and part of that program is indeed the question of, within those priority groups of the National Advisory Committee on Immunization, there's 4 large priority groups. We will not have enough vaccine in the first few weeks to months of the vaccine program to give vaccination to all of those people in those priority groups. So where do we start? How do we sequence vaccine over time? We will have enough vaccine to give to, this is me being optimistic. If the what we are seeing about the Pfizer, the Moderna, and now the AstraZeneca Oxford vaccine, and we have contracts, and we've heard the Prime Minister say, we are expecting those contracts to be honored. It's always a challenge when we're reliant on offshore manufacturing, and there's always things that can go wrong. With all of those caveats, we want to be ready as soon as vaccine is ready to get it to the right people at the right time safely and to be able to monitor safety. So what we are doing now is taking the NACI priority groups. We've across the country developed a statement of common principles that the health ministers have signed off on and the premiers will be discussing, and we are using those to look at who gets vaccine first. And I can tell you across the country we're all very much focused on who is most at risk and how do we protect them best. So it will not be a surprise that people who work in long-term care and people who provide services on the front lines, whether it's emergency department, ICU, COVID wards, are very high on those priorities. But there are other important people as well in many different spheres. So we're all looking at, is there a strategy where we focus on protecting those people who are most at risk in the areas where we're most seeing transmission, and take other measures to protect other communities until we have more fridge-stable vaccine that we're able to give to everybody. So there's a lot of discussions that need to happen. The ethical principles we've all agreed upon, and the guiding principles we've agreed upon, but those are the discussions we are having in detail, started a few weeks ago and are ongoing.
We have time for one more question. For everyone listening today, Dr. Henry and Minister Dix will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. For updated information about the province's regional restrictions, visit gov.bc.ca/regional restrictions. And for information about the province's new orders and pandemic supports, visit gov.bc.ca/COVID-19. Last question is from Georgie Smith, CBC.
Hi, Dr. Henry. Just another question on the vaccine rollout. On last night's federal provincial health ministers' call, Saskatchewan says they asked for more details after the Prime Minister's comments that Canada won't be the first to get the vaccine once it's approved. But there were very few details about the rollout and distribution. What have you heard from Ottawa about when BC would get vaccines? And are you getting enough information now for Dr. Brown to get the province's plan in place for a vaccine rollout?
Yeah, so we have been working on this for a long time. So at those higher levels, there's always details that they need. I can tell you that the BC CDC, we have an immunization program. Dr. Monica Naus is the lead that has been working with our Canadian Immunization Committee, with NACI. I'm on our Special Advisory Committee meeting where we are talking about those details. Exactly, we know, for example, that the Pfizer vaccine will come in frozen trays of 975 doses and it has to be reconstituted. So we have a lot of information that we do know. We know they're still in the final decision making about how much vaccine each province is going to get and some of those discussions, but we expect, and what we're planning for is first week of January, week 1 of 2021 to be ready to deliver the Pfizer and Moderna vaccines. And we will have phases after that. So we have the details we know that we need to start that process and to make sure we have everything in place to be able to do that. And that's our focus right now. Whether each lot is going to be approved, so there's a whole bunch of other pieces that need to happen. We have an independent regulator who gives what we call a notice of compliance, which is essentially a license for the vaccine to be used. And they are now doing a rolling process of reviewing data so that they can give that approval as in a more rapid process. Usually we wait till everything's published and then they look at it at Health Canada and determine whether there's enough data to support safety and efficacy. So how well does it work at protecting people? So those key pieces need to be in place and are in place in Canada as they are in other places. So Health Canada, the BGTD it's called, will be doing those approval processes and following the rigorous safety processes, independent safety processes that we have in Canada before the vaccines will be licensed. So our job is to make sure that we're following that process and that we're ready as soon as vaccine is ready to get it into the people who need that protection here in BC. So we are working very closely across the country. I spent most of Sunday talking about this with my colleagues across the country and in detail. So yes, right now we're getting what we need, but there's many things that most of us don't know, including, exactly how much will come, whether each lot will be able to be approved because each lot has to be tested for safety. So there's lots of unknowns that we all have.
Do you have a follow-up, Georgie?
I do. Many of the people we've spoken to recently in the Fraser Health region are asking for a complete lockdown of the region to try to get a handle on the outbreak there. What's your response to that? And can we get Minister Dix to answer in French for this question as well as the previous question? Thank you.
Sorry, I should have been shorter in the previous question. I think you can say there's lots of unknowns, and there's lots that we do know. And we're okay. In terms of, I have been in daily contact with colleagues in Fraser and Vancouver Coastal. We know that there's a lot of movement back and forth. We know that there are situations that are higher risk than others, and we know that we have downside impacts for each of the measures that we take. So our focus has been the same, and continues to be the same, which is keeping as many workplaces as can safely stay open, so that people get the services and the goods they need, keeping schools open because we know how important that is for children and for the negative impacts on children and families when children are not in schools, and making sure that our hospital system is not overwhelmed. So we are looking at every option that we have. We've never had a lockdown in that sense here in British Columbia, and we are looking at the important things that we can do to make a difference in where transmission is happening. And we are going through all of the options over the next 10 days to 2 weeks. So by December 7th, we will know what we need to do from here.
Oui, sur la deuxième question, premièrement, je dirais que la régie de santé de Fraser, ça fait partie de la région de Vancouver. Et c'est à cause de cela. Le fait est qu'une grande partie des gens qui habitent Fraser travaillent à Vancouver Coastal et aussi habitent à Vancouver Coastal et travaillent dans le territoire de la région de santé de Fraser. Donc, c'est vraiment la région de Vancouver qui était en cause. C'était à cause de la question de la transmission dans cette région que le Dr Henry a pris des mesures il y a quelques semaines régionales. Et ces mesures sont maintenant provinciales, mais je pense qu'il faut continuer à agir à fond pour répondre à cette question. Mais c'est vraiment la région de Vancouver qui a des difficultés. Il faut que il y a des mesures en place, il y a des mesures qui ont été prises la semaine dernière, jeudi dernier, et il faut les suivre maintenant à fond, tout le monde. Nous avons vu aujourd'hui les efforts du système de santé pour répondre à la crise, et il faut continuer à le faire, bien entendu. Mais c'est vraiment une question pour la région de santé de Vancouver. Mais j'ajoute ceci, que ce n'est pas tellement différent au nord ou dans la région de santé de l'intérieur de la province. Il y a beaucoup de cas, beaucoup de transmissions. Donc, vraiment, il n'y a pas de différence, pas de grande différence maintenant entre les régions. Il faut agir partout parce que le COVID-19, c'est partout dans la province et il faut répondre à fond partout. Je sais que tout le monde qui travaille et qui vit dans la région de santé de Fraser, je pense, ont réagi depuis quelques semaines d'une manière importante, surtout dans les cérémonies de mariage, etc., où on a vu une amélioration, pas totale, mais partielle dans ces types d'activités, et il faut continuer. Aux questions de vaccins, il y a beaucoup d'inconnus, comme la Dr Henry vient de dire, je pense. Mais pour notre part, il faut être prêt, n'est-ce pas? Et le Dr Brown va mener cet effort. Il va être le capitaine en travaillant avec Stephen Brown et Dr Bonnie Henry dans le domaine. Donc, qu'on soit prêt ici pour le moment que le vaccin arrive ici. On ne contrôle pas tout. Il y a des inconnus. Beaucoup de renseignements sont les renseignements propres des entreprises qui ont créé ces vaccins. Et il faut assurer tout le monde avant que ces vaccins sont mis dans la population qui sont quand même sains et saufs. Donc, il faut beaucoup d'efforts. Mais ça, c'est en partie un effort du gouvernement fédéral. Et on a beaucoup discuté. Mais pour notre part, il faut être prêt. Et nous allons être prêts dans ce domaine. Ça, c'est la tâche de Dr Brown, mais aussi d'un grand nombre de personnes un peu partout dans la province. Et je pense que les décisions sont difficiles, mais on va les prendre d'une manière qui est, je pense, une manière à l'auteur de nos efforts contre la pandémie. Merci beaucoup. À la prochaine, à vendredi. Merci. Thank you.
Thank you.